All right, can everybody see my slides? Great, awesome, thank you so much. So nice to be here with you all today. Sorry I could not make it yesterday. My name is Jose. I'm one of the third-year residents at Thomas Jefferson University Hospital and Family Medicine, and have been with BenGap as a medical student, now as a resident, and hopefully far into the future. I'll be presenting to you all today on strategies to evaluate your educational interventions. Some objectives for this session are to list 2 commonly applied frameworks for assessment and evaluation that have already been mentioned today. So I'm happy to see that everybody is familiar with those. To apply an evaluation framework to a case scenario, and then to outline an evaluation plan for their own projects. All right. And then, as I had mentioned, some of those frameworks that have already been brought up today include the knowledge, skills, and attitudes or abilities framework, the KSA, as well as Kirkpatrick's pyramid. There are other frameworks out there, but these are the 2 that we will focus on today. But perhaps in your kind of journey and crafting your project and in your conversations with your facilitators and advisees and institutional leaders, perhaps there's one out there that is more suited to your needs. Okay. So, I first wanted to kind of jump into the KSA model. K standing for knowledge, S standing for skills, and A for abilities and attitudes. I guess kind of to go into them more deeply, the K or knowledge stands for like the subjects, the topics, the items of information that, someone should know, perhaps by the end of your evaluation or presentation. Skills are kind of more technical or like manual proficiencies that are often learned through some sort of like skills-based environment that again might be your objective at the end of your evaluation. And attitudes and abilities, are more so of like the capacity to apply several knowledge and skills, together in order to complete, some sort of task or observable behavior. Oftentimes this comes up in our educational evaluations as perhaps confidence. At the end of the session and kind of learning some of the knowledge, learning some of the skills, how confident do you feel in your abilities or attitudes to like perform the task at hand. Okay. And this is just kind of reviewing the same thing. Some examples of this are for knowledge, giving some sort of pre and post like knowledge test as a way to evaluate some of the education taking forth in your presentation. We mentioned simulated patients or OSCEs or some sort of skills lab as a way to evaluate that skills development. And then, confidence surveys as a way to assess those abilities and attitudes. And then the other framework that you all have seemed to, be familiar with is the Kirkpatrick's pyramid, where, we kind of look at perceptions, learning, behavior change, and impact. And then just kind of clicking through this. Using Kirkpatrick's pyramid, there are kind of different levels of evaluation that we could undertake when we look at our educational evaluations and kind of goals and objectives. The level 1 or kind of like the perceptions level oftentimes refers to, how participants react to training. So this is where, attitude surveys or satisfaction surveys or confidence surveys kind of might be used to capture, these perceptions. Level 2 learning oftentimes has to, deal with like a slightly deeper understanding in the training. So was there like an increase in knowledge or an increase in skills or experience? This is where either some sort of like knowledge-based pre and post test or some sort of like checklist or something, say like in an OSCE environment. I think the example we have here is on cervical cancer screening or on cancer screening in general. That is something that might be used to kind of, evaluate your educational goals and objectives at a slightly higher level than just the confidence, that people might have gained at the end of your presentation. Kind of bumping up to a higher level is behavior, right? So this is looking at if individuals are utilizing what they learned, either through your presentation, your skills lab, and is there an observable change in their behavior, right? So this is where, perhaps some like direct observation techniques could be used to capture that behavior change. And finally, the highest level is impact, right? So at the end of the day, is there a positive impact, on the group of individuals that you are interested in, the population. So the example we give here is like breast cancer mortality. So, say you have a project or some sort of educational presentation that you are giving with a goal or objective of, increasing rates of breast cancer screening in underserved communities, right? So like a way to measure impact, at the highest level, according to Kirkpatrick's pyramid, is to, see, well, does this group of interest now have a lower kind of mortality when it comes to, breast cancer? Are the professionals, the students, the technicians, whoever your audience is at hand, given your presentation and their ability to, learn appropriate kind of screening guidelines, how to kind of encourage completion of those screenings and how to kind of, move forth with follow-up of those screening assessments at the end of the day. Do these like underserved groups or communities now kind of come forth having, lower mortality when it comes to breast cancer? So just some examples that help us kind of, put into some sort of context this Kirkpatrick's pyramid. And kind of moving forth today, we'll have some more examples in which we'll kind of use this pyramid and a previous Bengap project to see how we could kind of come up with ways to evaluate our presentations or projects. All right, and I think how does all this come together, right? So I think earlier today we talked about the Kern model and kind of using that to guide, the framework of your project creation, and then using, some of these evaluative frameworks such as the KSA or the Kirkpatrick model to then, help guide how exactly you are going to, evaluate your goals, your objectives, your educational what you're trying to achieve through your presentation. And I think kind of, after going through some of the homework that you guys had earlier yesterday and into today, in which Dr. Sanchez had you start to work on your ESA kind of outline, all of that, is something that you're going to have to put a lot of thought in when it comes to writing your ESR templates. So right here are just a little snapshot from the MedEd portal website that is a template on how to write your educational summary report. This is, as I mentioned, the document where you summarize all your work. There are 5 different types of ESR templates, depending on the type of kind of project that you were working on, whether it be a standard workshop, some sort of sim, some sort of standardized patient or OSCE sort of activity, some sort of team-based learning, or some other type of assessment. And it's important to follow the directions listed on each of these templates. So, this slide in particular shows what is written for how to write the results section. And here you'll see bullets 1 and 2 are actually common across 4 of the different like workshop types. one of which being a little different. So, if you kind of read this here on the screen, it almost specifically mentions or kind of wants you to describe how you evaluated, the impact of your educational resource to provide evidence that the resource or experience was successful and that your evaluation should align with your educational objectives. And then in particular, right, it's asking if your objectives are skills-based, describe the results of the skills assessment. And then again, it mentions like Kirkpatrick's pyramid as a helpful tool in conceptualizing the level of evaluation. So, by spending some time being mindful up front, using some of these frameworks, it will actually kind of help, guide your evaluation and certainly kind of your write-up of your presentation when it comes time to submit to MedEd portal. Okay. And this is just now just a slight version of what the ESR template might look like for that fifth kind of workshop type, the assessment type. But again, kind of hitting on some of the similar points that I just mentioned. Jumping in now to an example of how to really kind of use these frameworks to guide our projects. I want to use the example of a group of students who want to create an interactive workshop on the health status and healthcare issues of Puerto Rican patients, right? So here we have some draft learning objectives that, this kind of group came up with. One is describe the history of Puerto Rican identity within the United States. Another is, compare and contrast, health issues and disparities of Puerto Rican individuals residing on the island and on the mainland. Next is explain how at least, one state or federal policy has impacted the health outcomes of Puerto Ricans on the mainland or the island. And finally, identify at least 2 healthcare access issues faced by Puerto Ricans on the mainland or the island. So I think if everybody could take just a few minutes and probably reflect, let me go back to this Kirkpatrick's pyramid and how you might kind of come up with ways in which you might evaluate these educational workshops across the 4 different levels of Kirkpatrick's pyramid. So I'll give everybody just a few minutes just to kind of think through and perhaps we could get a few volunteers to kind of chime in and tell us how they might, measure perception, measure learning, measure behavior change, and finally some sort of, grand impact that our, group of students might want to hopefully achieve. All right, so I guess we could start with, looking at like level 1, like perceptions or reactions. What are some ways in which you could evaluate an example workshop in order to try to capture this kind of perception level, or think about like an attitude survey or something like that. What do folks think might be something that might be implemented, or some sort of example of a survey to sort of capture this perception, this first level of Kirkpatrick's pyramid?
I can comment for the first learning objective, describe the history of Puerto Rican identity within the United States. I think doing a survey prior and a post of the workshop, asking the participants on their confidence level in order to describe the stated learning objective, will being able to cover level 1 of the pyramid.
Yeah, absolutely, right. We perceptions in particular, or something that might come across as confidence, right? So how confident are these learners in feeling that they're able to achieve the objectives that were mentioned? So yeah, absolutely. How about level two? Level two, being some sort of actual kind of learning, going beyond confidence, and maybe trying to get to some sort of achievable knowledge base or skill. How would you perhaps go about trying to evaluate this educational workshop?
We happen to have a nearby clinic that serves underserved populations, including Latinx populations. I might work with our service learning director to put together a rubric to assess their behaviors while they're in that early clinical experience with that population.
Great. Yeah. I think in regards to behavior, I think we actually kind of jump up to the next level, level 3, right? So having a rubric, similar to something that might exist on some of the observations faculty might be, doing of students, either like on the wards or in some sort of, simulated environment that might try to get to some behavior change that might have been the result of this like educational workshop. So yeah, totally. How about just like some just pure, true, like, measuring if knowledge was gained, or if like a actual kind of specific skill or something else were attained, maybe taking it a step back, not all the way up to behavior change.
The simplest thing would be just some sort of objective assessment.
Yeah, absolutely. So, if there were some specific facts or data, or specific policies that you wanted folks to have knowledge of, doing an assessment, before and after, that, might kind of show a gain of knowledge at the end of the educational workshop is certainly a way to assess for, more true, like true learning or pure learning taking place. And how about finally, like impact? We had already briefly discussed level 3. How about impact? Some sort of, larger, outcomes-based measure.
I'll pitch in again,
but yeah, sure.
If someone else wants to talk, please do. One thing I think a lot about is double dipping.
Yeah.
So how can you get 2 publications out of one activity? I think it might be really interesting, and I'm reflecting on some work I did in the community a few months ago to actually hear from members of the population about the lived experience at the clinic. Has it changed over time since the intervention? And so in that way, I think you could probably get a standard scholarly publication out of it, in addition to an assessment on whether the population's experiencing a change.
Yeah, right. I think you hit the nail on the head. I think, the patient or kind of population experience or satisfaction of, wow, that we gave this kind of educational kind of workshop, kind of training to a group of providers or a group of, someone else involved in their care, and are they kind of, the outcome of like satisfaction, the community, that these group of patients, now see that, wow, like, or at least in their own kind of understanding that their care is better, or there's more access, or they're just overall kind of more satisfied with their ability to kind of interact with the health system. So yeah, perfect. I think you guys kind of did a great job in kind of walking through what some of the educational evaluations at the different levels of Kirkpatrick's pyramid might look like. So just to kind of like summarize everything in one place, we discussed kind of level one, kind of reactions, perceptions, kind of pre and post surveys looking at confidence, compare and contrast health issues and disparities of Puerto Ricans residing on the island, going back to our objective. Did this confidence score go from kind of 0 to 1 to 3 to 4, by the end of the workshop in the groups that you were surveying? Looking at knowledge and skills, did you give some sort of like true like knowledge base with kind of facts and data, and are folks able to answer that more correctly, at before compared to the start of the presentation now at the end? And finally, with behaviors, it was mentioned, some sort of direct supervision of, the behavior change that might have taken place after the fact, using some sort of standardized rubric. And finally, seeing if the population of interest is kind of satisfied, with some of the changes that have taken place, or have they noticed, kind of a higher level of care or something done through like a patient satisfaction survey that I feel most clinics, most hospitals are probably doing anyways. So yeah, I think that was really cool. Thank you so much for participating in that exercise. I know some of this could be a little tough over Zoom. So, now that we've kind of discussed some of the frameworks, how we could use, a framework like the Kirkpatrick to guide our evaluation, I just wanted to quickly dabble in, some research methodologies that we may or may not be using in our projects. We're all familiar with like qualitative research, focus groups, interviews, ethnography, things that focus on open-ended questions, as well as like quantitative research, more scales, surveys, things oftentimes that are like more numeric, either yes, no, or using some sort of scale, that participants could circle or write down, oftentimes very kind of specific closed-ended questions, as well as mixed methods, kind of using both. Looking at qualitative research, as I mentioned, it's something that is used in all sorts of academic disciplines, traditionally in like the social sciences, but also market research. The aim is to gain like a deeper understanding of human behavior, and it investigates the why and how of decision making. If you opt in to use open-ended questions, it is sufficient to kind of just list and describe responses, rather than analyzing qualitative data. I think for those who might have more experience, perhaps doing qualitative research methods, oftentimes there is kind of this analyzing or kind of categorizing of qualitative simply just list out some of this qualitative data is simply just to link back how it relates to some of your objectives at hand. So here's stealing from, one of the ESRs from, an actual successful submission to Meta Portal of this kind of similar topic, kind of looking at some of the differences of health status of Puerto Ricans living in the US. We could see here how some of the qualitative data gained from the survey used was simply just kind of placed under each objective just to show the relation to the objective. So kind of looking at objective 1, describe the history of Puerto Rican identity within the United States. The team that wrote this ESR, kind of included the comment, I appreciated learning about how the historical context of Puerto Rico and current events affect healthcare. So just kind of illustrating that, there was, a kind of positive experience by one of the participants in the workshop that linked directly back to objective 1. And, as you could kind of, read all the way down, you'll see kind of similar kind of excerpts from different surveys included under each objective. And this is something that's totally fine, and it's a commonly used method throughout many different MedEd portal publications. So if you were to use some aspect of qualitative research, even just for feedback, on how the module kind of address the objectives, and not necessarily for trying to capture, some skills attainment or knowledge attainment or behavior change attainment, this is something that you could use. All right, and then kind of moving over to quantitative research, again, it's a systematic empirical, investigation. We're using kind of math and numerical data techniques. The objective is to, develop and employ math models, theories, or hypotheses pertaining to a phenomena. Something that I just want to point out, and again, the purpose of this talk is to not go into statistics, but once you do have kind of a data set in hand, make sure that you spend some time with either a fellowship co-director, an institutional like statistician, or someone who is, confident with statistical methods to try to, pick and choose what sort of statistical analyses might be most appropriate for your data set in hand. In particular, for small samples under, 100 surveys, or those that might not kind of fit a normal kind of distribution, we use like some non-parametric tests. Whereas, if you have something that might follow a more normal distribution or just have a very, very large data set, you might consider more traditional parametric tests. And this is just, again, looking at the same ESR from our example publication that kind of shows some of the quantitative research methods used. So, self-assessment of participants regarding their confidence and their ability to meet the workshop's learning objective range from no confidence to complete confidence. So, here just kind of describing the scale in which they used, which was a like 0 to 5 sort of scale or 0 to 4 sort of scale. They used a non-parametric test given a relatively small sample size. And then for each objective that they looked at, they did describe confidence improved and that the difference was statistically significant. So, certainly in the table, they kind of, showed what the average kind of confidence score was, but simply writing it out, all they had to state was that the confidence was improved, and they listed, the confidence interval at which that, statistical significance was achieved. This is again, just to kind of, show how, some of this might look like in writing at the end of your project as you're getting ready to prepare your publication and submit it to MedEd portal. All right. And I think I just wanted to take a quick second just to also show you some other examples. So I just wanted to quickly stop sharing this screen and move over to a publication that I was involved in, just to highlight how some of the different quantitative and qualitative results might look like at the end of the day. So I'm going to stop sharing real quick. Let me switch my screen. Okay. All right, so this was a project. This is straight on the MedEd portal website. Can you guys see my screen? Perfect. The title of it was Providing Diverse Trainees an Early and Transparent Introduction to Academic Appointment and Promotion. Dr. Callahan was on this, myself, Dr. Sanchez as well. Essentially it was a module in which we were kind of making it clear to members of the audience who were pre-faculty members, whether they be medical students or residents, kind of what the academic appointment and promotion process consisted of. Some of our educational objectives are listed here. Describe diverse trainee perceptions of academic appointment and promotion, define different terms that are pertinent to that process, compare elements of CVs and portfolios, outline the step of submitting a promotional package, and then just listing tips for kind of documenting content on CVs, portfolios, and promotion packages. So just kind of combing through to the results section and how we evaluated this educational module. As you see here, we had a brief kind of just breakdown of the demographics of, the audience that was involved, medical students, resident participants, everything from gender to sexual orientation to race to training level. Then we also did a breakdown of, who our facilitators were. Some of our facilitators were single presenters, others were collaborators. Some of our presenters were kind of across different professional levels, from assistant professor all the way to full professor. And then kind of more directly relating to what we just discussed, we kind of showed how learners from the 8 regional conferences responded to pre and post workshop questions in relation to their confidence of being able to navigate the tenure and promotion process in academic medicine, which was kind of one of our objectives. And you could see here, confidence increased from pre to post workshop. Again, ability to update your CV with pertinent information, tying it back to one of our objectives. And again, overall confidence increased from pre to post workshop, and kind of hitting on one of the objectives of kind of decreasing the transparency regarding faculty promotion process. We also, obtained, a significant kind of decrease from pre to post workshop. So, again, this is just to kind of show how you could capture some of the in this case, not learning, but confidence attainment, pre and post workshop, kind of going through, your connection of the objectives, to a specific framework, and in this case, the Kirkpatrick pyramid, and a more kind of perception or confidence kind of building level 1, and making sure that, the way in which all that is kind of captured and written in our results section kind of tie back to a lot of the groundwork that we laid at the start of our process in getting our educational workshops and projects off the ground. All right, so I'm just going to go back to the slide. Okay. Share screen. All right. So, now that we've kind of gone through different ways in which you could evaluate your projects, some next steps to keep in mind are, to select a framework to evaluate your data, whether it be the KSA, the Kirkpatrick pyramid, some other framework that we did not mention. Review, your Esr templates on necessary content for methods and results sections. So, going to one of those 5 different ESR versions that exist, depending on some of the specifics of your project, and seeing exactly what is required in those results sections. And then also kind of exploring how others have evaluated similar content on Meta Portal. So, I kind of highlighted how we addressed some sort of confidence testing in a module that I participated in. And you could certainly do the same, kind of going through some of the different MedEd portals published works and seeing how, you could kind of perhaps mirror your process to similar things already in existence. Any questions?
Great job. Thank you so much, Jose. So I think, what I really want to stress to all the fellows is that, once again, Methods Portal is a unique journal. Methods Portal is about giving you credit for the teaching materials that you develop. Jose went through 2 different models in which to evaluate, 2 models or frameworks to evaluate your content, Kirkpatrick and KSA. Once again, I'm going to ask you all, what level of Kirkpatrick is sufficient? What is the lowest level of Kirkpatrick that is sufficient to get into Methods Portal? Put your responses in the chat box, or you can verbalize it. What is the lowest level of Kirkpatrick from level 1, 2, 3, or 4? Level 1,
2.
To successfully get your material into Methods Portal. And the reason why I stress this, and I'll explain it to you again, this is really important. This is probably where people have the greatest hiccups when it comes to evaluation. What level? Only saw 1 response. In the chat box, is there more than 1 response, or am I just missing something? I see 2 responses now. I want everyone to respond. What is the lowest level of the Kirkpatrick model that is sufficient to get into Methods Portal? Okay, I see 5 responses. I know there's more than 5 people on here today. Okay, 6, 7. Any more? 8. All right. Anyone else? 9. Okay. Jose, please put up the Kirkpatrick model again. Level 1, perceptions. If all that you do is collect perceptions data, that is enough. Level 1 perceptions data is enough to have your module accepted into Methods Portal. The sole responsibility of the co-fellowship directors, including myself, is to help you achieve level 1, maybe level 2. The co-fellowship directors are not responsible for helping you achieve level 3 or level 4, because that is not necessary for Methods Portal submission. Level 1 is sufficient. Now, Kimberly brought up a really good point that if you do go on to collect level 3 and level 4, that gives you an opportunity to have more than 1 publication. because you're not going to use all of your data for the Med portal publication. You'll use level 1 for the Med portal publication, and then you will use level 3 or 4 for a separate publication. Any questions about that? Excellent. Okay. Any other questions about evaluation? Now, one other thing I'll just mention about learning, it could be a little bit, as written here, multiple choice questions, true, false questions would qualify for learning. OSCEs are quite intense. So knowledge-based questions with 4 multiple choice options or true, false would qualify for learning. You don't have to do an OSCE to qualify for learning. All right. Okay. I'm just trying to make sure that we keep it simple, because once again, this is a 1-year fellowship. And the whole idea is to help you submit within the 1 year. And there's a lot of different components. So last call for any questions.